So the inflammatory process is basically the same regardless of what causes it. So in acute inflammation, there is usually tissue injury going on. So sometimes timing varies with the specific cause. So inflammation may develop immediately and last only a short time, or it may have a delayed onset, like a sunburn. One time, a long time ago, I was visiting one of my friends in California, and we went to the beach, and I'm very fair skinned and should probably use a lot of sunblock, but I didn't use a lot of sunblock. And my friends kept looking at me and saying, okay, she's not getting sunburned. She's not getting sunburned. By the time we got home and later that night, I was a lobster. So that's that delayed onset of inflammation. It was miserable. I could barely wear any of the clothes that I brought on the trip. So sunburn, it's a type of inflammation. So it can be mild or can be severe and prolonged. The severity of inflammation varies with the specific cause and the duration of exposure. So moral of my sunburn story is wear sunscreen. And that's one of the 7 steps to health from the first chapter. So when tissue injury occurs, the damaged mast cells and platelets release chemical mediators. And the chemical mediators affect blood vessels and nerves in the damaged area. So the chemical mediators, there's a lovely green table, and I have it on the next page. They basically serve as communicators in the tissue fluid, sending messages to lymphocytes and macrophages in the immune system or the hypothalamus to induce fever. So those chemical messengers, they're telling our body like, hey, what's going on down here and what do we need to do? So a lot of times chemical messengers are created by damaged cells. So the specific chemical messengers, we'll talk a little bit about what each one and their major action. But in general, in the damaged area, they cause vasodilation. So those macrophages and neutrophils can get out of the capillaries, hyperemia, which is more blood in the area, and increase in capillary permeability, and chemotaxis to attract the cells of the immune system. So we'll talk way more about it in chapter 7, but the B lymphocytes and T lymphocytes have to be able to get into the area as well. So this is the chart from the book of the chemical mediators, and I don't expect you to remember all of them, but just to have a general idea of what they do. So a lot of these chemical mediators end up being a target for anti-inflammatory medications. So things like NSAIDs and aspirin, they affect prostaglandins. They decrease prostaglandins in the periphery, and that's how they decrease pain. So they all have an action in inflammation, and it's all part of the inflammatory process. So chemical mediators are the major players in the inflammatory process. So just observe and appreciate that chart. I don't expect you to memorize it. So the local effects of inflammation are redness and warmth, and it's caused by increased blood flow to the damaged area. Swelling or edema caused by a shift of protein and fluid into the interstitial space. Pain caused by the increased pressure of fluid on nerves and the release of chemical mediators like bradykinins and prostaglandins. And a loss of function. So the loss of function may develop if the cells lack nutrients, and edema may interfere with movement. So imagine this as you twisted your ankle. It starts to swell up, it's red and warm, you have pain, and the pain serves a biological function of like keeping you off your ankle. And you have that loss of function because of the edema. So the classic local inflammation effects. Those ones I do want you to remember. Exudate can be a part of inflammation. So exudate is a collection of interstitial fluid formed in the inflamed area. The characteristics of the exudate vary with the cause of the trauma. So serous or watery exudate consists primarily of fluid with small amounts of protein and white blood cells. Common example of serous exudates occur with allergic reactions or burns. Fibrinous exudates are thick and sticky and have a high cell and fibrin content. This type of exudate increases the risk of scar tissue in the area. So the way our body responds to inflammation is going to have an effect on healing, which we'll talk about in the second part of the chapter. Purulent exudates are thick, yellow-green in color, and contain more leukocytes and cell debris, as well as microorganisms. So this type of exudate is usually indicates a bacterial infection, and the exudate is often referred to as pus. So one of our favorite words, pus. So an abscess is a buildup of a localized pocket of pus or purulent exudate in a solid tissue. So around a tooth or in the brain, or you don't really want to have an abscess in your brain, but it happens. A hemorrhagic exudate may be present if blood vessels have been damaged. So if just knowing the type of exudate can kind of help you determine the cause of the inflammation. So those are the local effects. The systemic effects of inflammation can include a mild fever or pyrexia. If the inflammation is extensive, that's a pretty common reaction. Malaise, which is like the feeling unwell, fatigue, headache, and anorexia, which is the loss of appetite. Low grade or mild fever is common with extensive inflammation. If infection has caused the inflammation, fever can be severe, depending on the particular microorganism. So a high fever can be beneficial if it impairs the growth and reproduction of the pathogenic organism, but it doesn't necessarily do that. Depends on the organism. So fever results from the release of pyrogens or fever-producing substances from white blood cells or from macrophages. So pyrogens circulate in the blood and cause the body temperature control system, it's basically our thermostat in the hypothalamus, to reset at a higher level. And heat production mechanisms such as shivering are activated to increase cellular metabolism. So involuntary cutaneous vasoconstriction, that gives you paleness and cool skin. It reduces heat loss from the body. So voluntary actions such as curling up or covering the body conserves heat. And these mechanisms continue until the body temperature reaches the new higher setting. So that fever and chills thing that you get a lot with infections, that's what it comes from. So once you remove the cause of the inflammation and the infection, the body temperature will return to normal. It reverses the mechanism. So all of the changes that we experience with an infection are physiological changes in response to that infection. So these are changes in the body, changes in the blood with inflammation. So increased number of white blood cells, especially neutrophils, because they've got to clean the place up. Proportion of each type of white blood cells is altered depending on the cause. So that differential count is how they sometimes determine the cause of the inflammation. There's increased fibrinogen and prothrombin, which are plasma proteins involved in clotting, and that can result in that fibrinous exudate. C-reactive protein is a protein that's not normally in the blood, but it appears with acute inflammation and necrosis within 24 to 48 hours, so they can test for that. Increased erythrocyte sedimentation rate. Elevated plasma proteins increase the rate at which red blood cells settle in a sample. And so ESR is a commonly used blood test in the case of inflammation. Cell enzymes released from necrotic cells enter tissue fluids and blood, and they may indicate the site of inflammation. So all of these tests are used to help diagnose the cause of inflammation. So this is a great chart in the book. I actually love this chart. There's a nice chart on how the thermostat is reset in the hypothalamus too. So you get tissue injury, you get acute inflammation with release of chemical mediators. So there are all the effects of the chemical mediators and what happens, and it prepares you for healing. If the cause of the tissue injury persists, you could go over into chronic inflammation and scar tissue or fibrosis, scar tissue formation. If you get rid of the cause, then you can go into healing and regeneration of cells and resolution where the damaged cells recover. So scar tissue and fibrosis is where the damaged cells don't recover. Regeneration and resolution are where the damaged cells do recover. So the stuff on the right side of the chart is the better outcome. You might have a worse outcome. So the diagnostic test, we talked a little bit about looking at that chart. So leukocytosis is increased blood cells, white blood cells in particular in the blood, elevated erythrocyte sedimentation rate or ESR, and that's the test that's shown here is the ESR test. The differential count is helpful to distinguish between bacterial and viral infection. They test for circulating plasma proteins, and C-reactive protein, cell enzymes, and they're looking for signs of tissue necrosis. So potential complications of inflammation. When you have edematous tissues, microorganisms can more easily penetrate those tissues. Some microbes are resistant to phagocytosis. Inflammatory exudate also provides an excellent medium for microorganisms. So unfortunately, if you have inflammation, you might be more prone to infection. Skeletal muscle spasm may also be initiated by inflammation as a protective response to pain. So our muscles really can only do one thing, they can contract. And sometimes it's a protective response to pain, and it can cause muscle spasm, which can increase your pain. So that's never a good thing.